So today I'm unveiling the truth about blepharoplasty surgery and eyelid hollowing. We're going to talk about eyelid hollowing and look at it with regards to the upper eyelid and the lower eyelid and when that could possibly happen. So does blepharoplasty surgery cause hollow eyes? And with the upper eyelid, the answer is yes and no. So traditionally, surgeons were taught that when they're doing blepharoplasty to the upper eyelid to remove fat and muscle, and if that's done quite aggressively, it can then cause hollowing long term. And so you do see some people who have had blepharoplasty surgery many, many years ago who do have these hollowed upper eyelids. The truth is that now, especially in oculoplastic surgery, we're talking about volume preservation. And so with volume preservation, we're not removing fat if we don't have to, and we're definitely not removing the muscle if we don't have to. It's about repositioning fat to the outer area of the eyelid if it's fuller on the inside, and it's about making sure that we keep that volume there and reduce that risk of hollowing, and keep it to a minimum. Now, with the lower eyelid, the same principles apply. It's about volume preservation, and that's why increasingly we're looking at repositioning of the lower eyelid bags. Now, typically with lower eyelid blepharoplasty, those fat bags are removed. But nowadays we're looking at keeping that fat and putting it into somewhere more useful so that the bag doesn't show, but at the same time we're not removing that volume. So it's repositioning of the fat bag. But I agree that there are people out there who are still removing fat, and it's important to discuss this with your surgeon to see if that's suitable for you or not, and to discuss hollowing and what risks you may have for hollowing. So with upper and lower eyelid surgery, it's about volume preservation, and we're looking at repositioning and not excising the fat and putting it strategically in a place that's far more useful to give you a far more natural appearance and avoid that risk of hollowing. So I'm not going to say that I never remove fat, and absolutely we do sometimes remove fat, and particularly in some conditions like thyroid eye disease, or if the fat in the upper eyelid is excessive and the eyelids look very heavy, and the patient is wanting to have a bit more of a hollowed appearance intentionally, then we do go for that approach. Absolutely. And remember, it's really important to look at somebody who is an expert in eyelids, and that I always recommend an oculoplastic surgeon so that they can look at you and assess you and operate in a way to try and reduce that risk of hollowing completely. It's about personalized surgery, looking at what's most suitable to you. Not everyone is the same, and being able to manage that and offer you surgery that can give you the best possible outcome. Understanding your blepharoplasty procedure fully before you go for your surgery is absolutely crucial. So speak to your surgeon, make sure that you feel absolutely comfortable with them. And that's the way for you to know exactly what's going to happen to you and try and minimize the risk of having unwanted results. Good communication with your surgeon is the key to a rejuvenated, youthful look to your eyelids.